For me, any form of social injustice is just wrong. Society should be a place where everybody is equal before the law, irrespective of your positioning, your status, your family, or your background.
Members of the LGBT community in Nigeria face a lot of stigmatization. They're discriminated against by society and the people they call their own family. Some of them have even contemplated suicide. A lot of things are on their mind. They have to act in ways that are contrary to what they believe in, just to avoid being attacked by the mob, being blackmailed, and facing discrimination. With so much going through their minds, how will they even find anybody to speak to? How will they access mental health care in Nigeria, where the psychotherapists and psychologists themselves have their own bias? This is Untold Facts, where we tell it just the way it is, however uncomfortable it may sound. I'm Isabella Akinshere. Welcome to the show. Today on the show, I have with me two guests. I have Ms. Olaide Akoni. Ms. Olaide Akoni is the Executive Director of Journalists Against AIDS, JADES Nigeria, a leading media-based non-governmental organization which seeks to contribute to the prevention, care, and control of HIV/AIDS, tuberculosis, and reproductive health issues in Nigeria. Over the past decade, Ms. Olaide has served in various capacities in JADES and in several other advocacy-based coalitions in promoting HIV/AIDS and TB treatment literacy, capacity building for media and civil society groups, and policy monitoring on universal access to prevention, treatment, and care services. Welcome, Ms. Akoni.
Thank you.
I also have with me Dr. Olutunde Adegbite. Dr. Olutunde Adegbite is a medical doctor who through his practice has worked in different capacities within the medical profession, which also includes sexual minorities. Dr. Olutunde currently is a medical officer at the 68th Nigerian Army Reference Hospital and also the resident doctor at the Tears Wellness Center. He's a medical activist, lending his medical profession to promote access to healthcare services to all. Welcome to the show, Dr. Olutunde.
Thank you.
So today's show is all about mental health. We're looking at the issues surrounding mental health in Nigeria with a specific look at the LGBT community. So let's start with mental health in Nigeria in general. What is your evaluation?
Well, the issue of mental health in Nigeria is just like a tip of an iceberg that we know about. The ones that we usually have in the hospitals, in the healthcare facilities, is a tip of an iceberg of what is happening in the general community.
When you say tip of the iceberg, do you mean that there's so much happening in society,
in
but
the
only
society, yeah,
the few that make
we
it to the
see?
hospital, that's
exactly.
what we see?
Exactly, yeah.
Okay. So you feel that these healthcare institutions are already failing to cater to the larger society?
Yes.
Okay. Would you agree with that, Ms. Akoni?
Yes, I do. I think that one of the issues to also note about mental health is there's a lot of stigma associated with mental health. And so because of that, many cases go unreported because we feel like, oh no, you don't want to be told that somebody is suffering from depression or, you know, or somebody has other mental health conditions. So as a people, as Nigerians, we normally would not go to seek care for mental health issues until it's almost late. So that's why you see situations where people don't report early and then very few people report because of the stigma associated with it.
Okay. Mental health in broad terms, some people would just think that that's the person who is walking down the street with their hair unkempt, wearing no clothes. But mental health is much more than that. Can you expatiate on the different facets to mental health?
Yes, we have a lot of them. We have anything like depression.
So depression.
Yes, anxiety.
Anxiety.
People worrying excessively. And the extreme part of it is we have schizophrenia, what the layman call madness, to say, being lunatic in the society.
Which is derogatory.
Yes.
Because it's a health condition.
Exactly. So, and some people have it and they don't know that they have it. Like something like panic attack, like people going for some functions and they cannot stand where a lot of people are gathering. So they have a kind of fear when they see a lot of people gathering together. So it's a form of mental health. So you can see that it's very difficult for people who know that they cannot stand where there are a lot of people are gathering. It's very difficult for them to come out that, oh, I'm suffering from, I've been noticing this in my life, that I'm having this problem. I used to have worry and anxiety when I see a lot of crowd. So in some aspects, it's very soft to
and some
diagnose.
aspects is very obvious.
Obvious, yeah.
Okay, Mr. Kwani, so sexual minorities in Nigeria, they come under a lot of discrimination, and this can lead to mental health issues. I mean, if you're panicking, you have a panic attack because you're afraid that a mob is going to attack you because of your sexual orientation, what can be done to address these issues and to actually allow these people to come out and be able to access good mental health care?
Well, I think that first of all, we need to understand the context in which sexual minorities operate in Nigeria. So given the fact that same-sex marriage is criminalized in Nigeria, there's already a context where they are stigmatized because of the fact that they are engaging in same-sex relationships. So that alone can cause somebody to feel depressed, probably because they are being attacked based on their same-sex orientation in their workplace and all of that. So it's easy that somebody can get into depression and other forms of mental health complications as a result of that. And the healthcare setting is also not helpful in the sense that within the healthcare setting, there are biases on the part of the healthcare workers about, oh, why are you engaged in this kind of practice? You know, so oftentimes the healthcare workers are judgmental. So already the system is such that anybody who has a mental health issue, who is a member of the LGBT community, might even have it aggravated when they get to the healthcare setting. So oftentimes the healthcare setting may offer little or no recourse. And so in most settings, what people from the LGBT community do is draw solace from one another. And that's why, you know, having support groups and drawing strength from one another is one way to go. But if you're not even open about your sexuality, you would not even want to seek solace with other people, and you may die in silence, you know. So there are a whole lot of complications that may arise, and that may be compounded by our system, you know. But it's also important that I believe that even within that difficult context, there are still health workers who are open and who are supportive and who can provide the required care that somebody who has a mental health condition has, you know. So it's about identifying who can provide that service within the hostile environment in which we operate.
Okay. Dr. Olutune, during your work at the Tears Wellness Center, I'm sure you've come across a lot of members of the LGBT community in Nigeria. Do they come there as a last resort, believing that this is the only place we can feel free to get the kind of health we deserve? Or are they able to access this healthcare in Nigeria?
Well, in Nigeria, it's very difficult having access to health care for them because of the societal, let me say, both institutions and the cultural prejudices that people have formed about these people. So it's very difficult for them to actually come out that this is what I'm suffering from, this is the challenge that I'm having, and these are the other background issues surrounding it. You see, because of the norms that we have at the,
what the majority is
believe,
doing
what
in
we
society.
believe in the society, we have formed a kind of institutional and cultural barriers against some other norms that may be different from ours. So it's very difficult for these people to come out because they know that people will discriminate against them, people will stigmatize them. So for them to access health care is going to be very difficult. And even for them coming out to tell you that this is who I am is very difficult.
So
and
I mean, first there's the stigmatization on mental health issues in Nigeria as a country. Then there's stigmatization of being a member of the LGBT community.
Exactly.
So they're fighting a battle on two fronts.
Yes.
I'm curious, under the Hippocratic law, or the oath rather, that doctors have to take, isn't there something like patient confidentiality, that you treat a patient and whatever they say to you remains secret? Or are doctors compelled to report these cases to the police, since it's a criminal offense in Nigeria?
Well, doctors are not compelled to report to any legal agency or something, but the problem is that we have these cultural norms, and we have the religion also play part of it, because the religion and the culture don't allow us to accept anything that is different from our own belief or our own views or our own opinions. So when you see somebody like that, the majority of what people do is to like neglect such person, or not trying to help him or her, because you don't want to associate with such a fellow who has identified, who has opened up to you that this is who I am. So you try to like create a kind of barrier, and because of that they find themselves helpless, and they just go on and on like that without people trying to help them.
Okay. Mr. Akoni, in your practice, have you come across such cases of medical negligence by these healthcare professionals who are supposed to provide good health services, especially mental health care? So I know you've worked with people with HIV, AIDS, tuberculosis, and sexual minorities.
Yes, in fact, we just concluded the International AIDS Conference on HIV and AIDS in South Africa last week. And one of the key issues that came up was the fact that a lot of key populations, that's men who have sex with men, sexual minorities, transgender people, one of the challenges they are still facing is being able to access healthcare. So access to healthcare services is not equitable. Why? Because they have several barriers they have to cross in order to access healthcare. And stigmatization and discrimination among the healthcare workers was identified as a major barrier that is still challenging members of LGBT communities across the world. So it is not only peculiar to Nigeria, even in countries where, same-sex relationships do not have criminalization issues related to them, they're still having these barriers because healthcare workers' biases still influence the way they attend to LGBT. So there is a lot of data to show that the way the healthcare services are being delivered to key population communities is becoming a key limitation. And if we don't address those barriers, the chances of, reducing the spread of HIV by 2030 is a pipe dream. So there are a lot of cases all over the world. And one of the charges from that conference was that healthcare workers and governments really need to look into reform of the healthcare systems and ensure that there is an enabling environment for people to access health, irrespective of who they are. Because access to health is a fundamental human right. And so if I, as a healthcare worker, want to address somebody's healthcare needs, I need to deliver healthcare services irrespective of who the person is, what the person believes in, because access to health for them is a fundamental human right, and that's where we should be going as a country and as a people.
Okay. In Nigeria, I'm sure you've come across cases like this where somebody who has mental health issues or is a member of the LGBT community, some of the parents of the family members say, go to either a church, go to a mosque, go and see, a traditional healer to cure you of this ailment. How do you educate such family members so that they desist from advising them like it's a medical condition, like there's something wrong with you?
Well, you need to like make them to understand that we are two people are never similar in all areas of life. Like, as you are sitting down, as I'm sitting down, you are a woman, I'm a man. So we have a lot of things. The color of your cloth and the color of my cloth, they are different. And so you need to bring up ideas to let them know that, see, for the fact that this person's opinion is different from yours, for the fact that who this person is attracted to is different from who I am attracted to, doesn't make this individual inferior. So you need to respect the differences that we have. So our differences must be respected, and then we must treat ourselves with equity and with fairness.
Okay. I'd like you to react to that, Mr. Panyu.
I think that's very true. I think that most of the time, the requirement that, oh, maybe you go and see a traditionalist and all of that stems from the lack of understanding that, okay, sometimes these are not just, these are not just traditional issues in quotes. If people understand the diversities, then they probably are more accepting of the reasons why some people behave the way they behave. But oftentimes we see things as either black or white. It's either, this person is, is on the right way or on the wrong way. So that's, and I think that we need to broaden our understandings and broaden our knowledge on some of these issues so that the responses are better. If you like the scenario you painted, if the parents of the LGBT were more understanding, they would say, okay, probably, okay, this person is depressed or needs to see a psychologist or a psychotherapist or provide some counseling sessions for the person, that would probably remedy the situation rather than saying, okay, you need to go and see a psychologist, you need to go and see a traditionalist, which may even worsen or make matters more complicated.
Dr. Olutunde, in your experience, dealing with members of the LGBT community, do you feel that a lot of times their mental health issues are aggravated or even caused by societal expectations, family members discriminating against them, or do you think they're just maybe caused by stress?
Yeah, it's aggravated by the family, the family members secluding themselves from the people who they have identified as members of LGBT. Take for instance, there was a case of a young man who, when his mother got to know that he belongs to this community, the mother started like broadcasting it everywhere, and she made all the family members to know about it, and then she will be verbally assaulting the guy, and in a way the family became hostile to the guy.
So they disowned him?
Yes, to the point that the mother had to tell him that he should leave the house. And because of that, at a point he had depression, and at another point he became so hopeless and became so, why am I living? And then he decided to go and attempt suicide. So this kind of thing in the family, in the institutions like health communities and in the societies, so we have them a lot.
Okay.
Just to add to that, a similar experience was shared by another Nigerian who presented at the conference where I just spoke about, and he was talking about a colleague of his who is HIV positive, who was also a member of the LGBTI community. And somehow in the place of his work, they got to know about the fact that he's from the community, and he was dismissed from work. And as a result of that dismissal, he fell into depression, he was not taking his drugs, and over time he developed complications and he passed on. So again, that's another clear example of how stigma and discrimination and some of these attitudes from society can impact even on the quality of health, the mental health, and even the general state of well-being of people from the LGBTI community.
That's such a sad story, and I just wonder if there were more healthcare practitioners operating that could have spoken to him, psychologists, psychotherapists, and allowed him to just express himself, maybe it wouldn't have ended in such a horrific way. There you've had it. You've heard from Ms. Akoni and Dr. Olutunde. There is help. If you're a member of the LGBT community in Nigeria and you're suffering from any mental health issues, there is help for you. There are people who are willing to listen to you and provide medical health care. Now, you might be wondering, what can I do? You can do something. You can be more accommodating, just as Dr. Olutunde said, more accommodating of that person who has a different sexual orientation. Technology can be employed so that these people can get the help right where they need it in their support groups. So many answers have been shared here, but we want to hear from you. All you have to do is use the hashtag Untold Facts. And we are Tears on Facebook, and we are Tears Nigeria on Facebook, Tears Nigeria on Instagram, and Tears Nigeria on Twitter. Till we come your way again, I'm Isabella Akinshere, and this is Untold Facts.